My name is Caroline, like you have all been informed, and I'm part of Monet Ward. And we commenced this project, the Reducing Restrictive Practice, on Monet Ward in 2021. And as most of you are aware, there's been a lot about restrictive practice in the media, the recent BBC panorama, and Monet Ward looked at a lot of issues around that. And in 2021, we employed the patients, their carers, the family members, the staff, and the whole team. And there was a discussion around how we could improve the patient's experience and also ensure that patients have a good experience when they come into hospital, and also to reduce the incidence of restrictive practice in terms of rapid tranquilization, use of rapid tranquilization, use of restraints, and also reduce the level of complaints that we get. Due to this, we looked at how we could reduce restrictive practice. And the team is basically what you can see on the screen, including our patients, the family members, and even sometimes we find out that everyone at every level of discipline, in terms of the domestic staff, the occupational therapists, and psychologists, everyone was involved in this project. The aim of this project was to reduce the incidence of restrictive practice on Monet Ward by 50% by March 2024. At the moment, I can say we have been able to achieve that even before the time limit that we have. And that's because we had the support of our QI team and Chrissy, who is sometimes on the ward, helping us to channel our project to the right direction. We had a lot of drivers, the primary drivers being our patients, the family members, the staff on the ward, the environment, and also going through the secondary drivers. And the major change idea was increase in activities on the ward. And in 2021, sometime in May 2021 when we started, you can see from the results and the data shown there that there were a lot of incidents regarding restraints, and we could see the spike there up until 11, the point 11. And when we introduced the morning safety huddle sometime in 2021, sometime around October, we saw a drastic reduction in the incidence and in the use of restraint. And this is because we had a better discussion among the team members during the morning safety huddle meetings. And also we employed the use of mutual health meetings in the morning with our patients, where patients are able to express themselves and let us know their needs. And we are able to get cues around that as to proactively meet their needs rather than being reactive. And also we had a better discussion among ourselves, our staff members, during our weekly debrief meetings that we hold every Wednesday. So around discussion around what has led up to the incident and ways of actually managing it better next time. So this also helped in reducing the incidence of the use of restraint. And sometime in June 2022, we were able to increase our activities on the ward by getting an activity coordinator. And also, there was a particular time, that was in June. As soon as we increased that, we were able to see reduction in the use of restraint on the ward, as you can see on the data. And then I could remember also sometime this year, around February, we had a patient who was very, very unwell at the time. And he pulled out the activity door room, so that even helped better for us. We used that as an advantage. So we got a staff member to stay there all the time, and patients could go in and come out at any given time. And that also helped to reduce the level of restraint and the use of restrictive practice. We saw that a lot of patients became more active on the ward. They were able to do activities that they enjoyed and they wanted to do. There was no timetable as to the use of activity room. The successes that we had during the 2022, whilst we were in this project, Monet World got an accreditation from the Royal College of Psychiatry, and we also had reduced referrals to PQ, so there was no need to refer patients to PQ all the time. And then there were reduction in restraints. We also used our zonal observations effectively by a staff member on the zone actually allowing patients to go into the activity room in and out as they will and as they wish. And thank you. Well, another challenge, the challenges that we had is that we have no control over the group of patient mix that we have on admission. And also we're looking at staffing. Due to staff sickness, sometimes we have people leaving, and also getting the new staff members to get into the ethos of QI change initiative. The next step that we're looking at is looking at the ongoing challenge of our patient mix, and also the Monet ward becoming a default ward for patients with mild learning disability and ASD. However, we have the support of the CCG having to commission different trainings for staff members to be able to care for this group of patients. That's it. Thank you.